What's up, everybody, and welcome to this episode of the Wellman's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keone Tita. Keone, how are you today?
I'm doing good, Brian. I'm excited today because we're talking about something that I see a lot of in my clinic, and I think you're going to actually see a lot once you get in practice, especially with what we have with the aging population. We're going to talk today about dementia. Let's just go over like an overview of it. I think on this podcast, go over like the different types of it, signs and symptoms, risk factors, and then maybe the next podcast we can just go over the treatment, conventional and unconventional treatment, and some of the evidence behind those treatments.
All right, so let's dive into understanding it.
Yeah. So dementia, most people have an idea of what that means. It basically describes a group of symptoms that occur when the neurons or brain cells stop working properly. So as you can imagine, you're going to have symptoms like cognition deficits, memory loss, maybe personality changes, and that type of thing. Dementia is a big catch-all term. It encompasses a group of diseases or disorders. The most common type is Alzheimer's. So we've all heard of that. And then there's other types, like there's something called frontal temporal disorder dementia. There's Lewy body dementia. There's vascular types of dementia, and then there's mixed forms of dementia, which can be one or more of what I've just mentioned there. But the most common type is Alzheimer's. And with an aging population, it is a disease of aging. And so with an aging population, Alzheimer's is certainly increasing. And worldwide prevalence of Alzheimer's, I think, what is the estimate in the United States? I think 16 million individuals age 65 and older diagnosed with Alzheimer's.
Wow.
And they're estimating that's going to be that amount or more by 2050. So it's a big deal. And as we age, we are living a lot longer, so we're seeing much more prevalence of that, and we're seeing much more prevalence of these diseases of aging.
Right.
So there's certain medical conditions that can kind of mimic this, and may not be one of those few that I just mentioned, types of dementia, but they can mimic this. So as you can imagine, we talked a lot about this, that certain medications can cause, kind of things that look like dementia. So you talk about side effects of certain medications. So you definitely want to rule out that it's not a medication issue. This is the big deal because with older people, many of them are on lots and lots of different medications. I mean, depending on what state you're in. I mean, if you're over the age of 50 or older, I mean, you can have like 10, up to 10 to 15 different prescription meds. And just a mix of those are probably going to cause some type of, cognition deficit or something. So it's really good to look at that stuff. And then such things as like chronic forms of stress, even acute stress, anxiety, depression, any type of emotional problems can lead to things that look like confusion, things that have dementia type signs and symptoms. Vitamin deficiencies, it's a big deal. Certain B vitamins can mimic that. There are certain vitamins that, as we get into this, will actually there's some theory behind it that it will help prevent dementia illnesses. One that I'm thinking off the top of my head is like vitamin D. Drinking too much alcohol is another one. So alcohol could definitely cause B vitamin deficiencies, but also, both acutely, if you drink too much alcohol, and both chronically is a big risk factor for dementia, can cause brain deficits. It's interesting because in animal studies with, chronic stress or anything like that, you do start seeing like brain deficits and shrinkage with chronic stress. This can also be a risk factor. So stress is a big deal. So quelling stress. So as we go through this, you're gonna you kind of get an idea of what you may or may not be able to do with your lifestyle to help tone down the stress response that all of us are dealing with, right?
Mm-hmm.
So we talked about a lot of this on some of this stuff on our podcast. Well, there's some pretty interesting research on meditation, where you're kind of quelling or tonifying, I should say, tonifying the parasympathetic nervous system. It's a great way to prevent stress and anxiety. And over time, what you see a healthier brain. And that's what we're talking about. We're talking about an unhealthy brain, a brain that is just been subjected to insults over a lifetime that will cause these deficits, like memory deficits, that can lead to dementia.
Yeah.
So one of the big ones, and we've talked about this, and you see this over time, it's not that uncommon for people to have, blood clots that can cause like little infarcts in the brain, where there's some oxygen deficits in the brain over time as we age. So you can actually see this on imaging.
Mm-hmm.
And the more that you have those, the more likely that you're going to have dementia type illnesses. And so blood clots are usually the result of inflammation. They're usually a result of cardiovascular disease, and also, things that are related to that, like diabetes. And it's interesting to note that diabetes is chronic diabetes. Some people are saying that, well, chronic diabetes is actually the effect that it has on the brain. You could even say it's like a type 3 dementia. So blood sugar issues are a big deal. Blood sugar leading to lots of inflammation and having devastating effects on numerous organ systems, including the brain. Mm. Other things that can affect it, if you have any type of infection, central nervous system infection, tumors, that type of thing, these things will resemble dementia. Delirium, that's a confusion in thinking or reduced awareness in your environment. Usually it's an acute onset, which can look like dementia. Usually it's not long lasting, but it can be confused. Another big deal is head injury, right? So acutely a concussion, but we also know that head injury, repeated trauma to the head, can lead to a condition that mimics dementia. And then thyroid, kidney, or liver problems can also look like that.
So all these things can resemble dementia, but they don't.
They're not necessarily. Yeah, they're not dementia, right?
Mm-hmm.
So if you go through this and these are some of the rule outs that you can do. And I want to go through that list, because when we talk about like vitamin deficiencies, well, that's kind of hinting to what we'll probably talk about in another, on the next podcast about, mm-hmm. Well, if that's true, then are there some type of vitamins or nutrients that we can do to either help prevent, or is there actually some studies on it that show that it may help with treatment?
Yeah. So, okay.
All right. Cool. And keep in mind, we're talking about dementia. We're talking about an illness that really we don't understand it completely. And there is no, at least from the conventional standpoint, there's no cure. There's no cure for it, at least at this point in our history here. Other conditions that are more severe than what we just mentioned are going to be that can have dementia-like symptoms. You probably heard of Huntington's disease. This is an inherited progressive brain disease. We talked about repeated head trauma, right? Chronic traumatic encephalopathy. You see this in football players, boxers, repeated brain injury. HIV-associated dementia, that will show up as a dementia. There's a disease called Creutzfeldt-Jakob disease. It's a rare brain disorder. It's kind of like the human counterpart of mad cow disease, if you've heard of that. And then agoraphilic, I think I'm pronouncing that right, grain disease, which is a late onset degenerative disease, which really looks like Alzheimer's in the fact that it causes like you see what's called these tau proteins accumulating in the neurons and in the brain there, which is a sign of Alzheimer's and other types of dementia.
So these are things that can accompany dementia or lead to dementia, or what kind of
They're,
category?
they're actually they're a standalone problem by itself, but
Uh-huh.
look very much like the stereotypical um, dementia diagnoses that I mentioned at the beginning, right? Which,
Okay. Just a little bit more specific with
Alzheimer,
a
yeah,
cause or
frontal,
something.
right, right.
Okay.
Um, and then there are, so we mentioned some of the things that look like dementia, and these are dementia-like conditions that some of them of which can be reversed. So we talked about infections of the brain, right? So
Mm-hmm.
it can look like dementia. So that a lot of that stuff can possibly be reversed. Also, infections of the brain. It's really interesting. Some people are now saying that things like Alzheimer's are actually diseases like Alzheimer's are actually can be due at least in part to chronic brain infections.
Huh.
So that's interesting. So that leads to a whole nother thing about, well, what treatments can arise out of that? And now you're talking about maybe vaccinations or antibiotics or things like that that may prevent prophylactically these types of illnesses. So we'll get into that. But so infections and immune disorders, some of these things can be reversed. There are also metabolic problems, endocrine abnormalities. So for example, people with thyroid problems or low blood sugar, right? If you ever seen somebody that's severely hypothyroid, they're just not on point with thinking. Especially this is true with low blood sugar, right? If you ever seen anybody with really low blood sugar, I mean, talk about a state of confusion. I mean, they're slurring their speech. They don't, they're not thinking properly.
Mm.
If there's an impaired ability to absorb B12, you can develop dementia-like symptoms and other personality changes. So nutritional deficiencies, not drinking enough water, right? How much have we talked about that?
Yeah.
Chronic alcoholism, not getting enough B6. So again, we're talking about B vitamins. Side effects from medications or reactions to medications, any trauma to the head, so subdural hematomas, bleeding between the surface of the brain and the covering of the brain. This is very, very common in people, especially the elderly, with falls. I just had a patient the other day who, one of the big things in the elderly is they're not drinking enough water. And
Mm-hmm.
this person certainly was not drinking enough water and definitely put him in a confused state. But also because of that, had electrolyte balance and passed out from it. Okay. And then hit his head and then had this subdural hematoma. So it was like one problem after another. So
Yeah.
it's very, so there's a lot of things, simple things that you do in your lifestyle to certainly prevent hits to the head.
Yeah.
But, if you're not drinking enough water, that in itself, or not eating enough, that in itself can give you like these acute dementia like signs and symptoms that are not necessarily dementia, but can mimic it. But also, over time may contribute to dementia. But the nice thing about it, these things can be reversed.
Yeah,
And
it's funny
then,
you mentioned that because it was my first week on clinical rotation, and I
yeah,
saw a very similar story with a patient who basically had diabetes and low blood sugar,
yeah,
passed out essentially, hit her head, so on and so
right,
forth.
right. I
So
mean, so those are really simple things. Those are really simple things that you can prevent. You can prevent falls by just making sure your blood sugar level is stable or drinking enough water and that type of thing. So it's an important consideration. And then think about this, right? I mean, I'm getting to the point now where, I grew up playing football. I knew you played contact sports too. I mean, think about how many hits to the head that you've taken, and now the research is showing, right, that just minor hits to the head may lead to some cognitive deficits later on in life. I mean, that's
yeah,
crazy.
yeah,
That's crazy,
yeah.
Um,
I started playing football in third grade,
right,
all the way
right.
up. Yeah, I think about it all the time. Not a good idea.
Yes. So knowing that we'll get into this, but knowing this, that you're going to get an idea we'll get an idea from these two talks that we're doing are, okay, so what can you do if you are playing football or if you have dementia type, symptoms or signs? What can you do to help prevent or possibly help treat or quell the injuries that you've had or the hits to the head over time. So
Great.
one of the other things that is a real possibility is poisoning, like acute poisoning. So, heavy metals, exposure to volatile organic acids, alcohol abuse, anything that can cause the neurons not to be happy. So any poisoning can do that, and you can see. And usually these things can be reversed. But if you're chronically being exposed to them, you're probably increasing your risk of dementia type illness. And and then any space occupying lesion too, right? Like a brain tumor can cause dementia-like illnesses. And again, these things can be reversed if you can reduce the occupying lesion, like a tumor. Of course, makes sense if you are not drinking enough water and you're dehydrated, you're going to have some type of deficit there. But that also is true, right? If your brain is not getting enough oxygen, right? So things like carbon monoxide poisoning, heart attack, anything like that. Of course, certain areas of the brain are not going to be fed with oxygen if you've had a stroke, if blood flow can't get through there. There's another thing called normal pressure hydrocephalus, which is caused by enlarged ventricles in the brain. It's just an excess of cerebral spinal fluid, which can be treated and also cause like memory loss and gait problems.
Mm-hmm. Yep.
So what are the signs and symptoms? So you have cognitive changes and you have psychological changes. So the cognitive changes are going to be things like memory loss, difficulty communicating or finding words, difficulty with reasoning or problem solving. A lot of times these things are going to be, the first early signs are going to be, of course, noticed by like close friends and family. Mm-hmm. Difficulty handling complex tasks, difficulty with planning and organizing, difficulty with coordination, motor functions, and then just general confusion and disorientation. Those are the cognitive changes that you may see. Another thing that you may see are that kind of there's a gray area between cognitive and psychological changes, but you'll see possibly personality changes very early on. Yeah. So, for example, just give you a little story. I remember going out to eat with my father and my grandfather and some other family members, and it's very, very interesting. My grandfather at the time was like, I think 92 or 93, and he wanted to take us all out to dinner, so we went out to dinner. And my father and my grandfather is he never drank. He drank very little his whole life, but my father ordered a beer, and my grandfather was like, out of the blue, "No, you will not order a beer." I just went off, lost his shit, so to speak. Uh-huh. And at the time, we're all like taken aback by that. And my great aunt, who's also been around him, said, "Oh yeah, he's been very belligerent lately." And this is a sign. This can be a sign of dementia, where you just have these weird like outbursts, or sometimes you'll see people with early signs accusing close family members of taking stuff, or just thinking that they're out to get them. And this can be really, really stressful for other family members if they don't know what's going on there. Yeah. Right. So other psychological changes could be like depression and anxiety, of course, inappropriate behavior, which we're talking about there, that can range a whole gamut there. Certain paranoia, right? Thinking people are out to get them, accusing them of stealing, agitation, and then hallucinations, auditory, even visual. So, let's talk about the risk factors now, because it will also give us some insight into what we can do. So there are risk factors that you can change, and there are certainly risk factors that you can't change. And the main risk factor that you can't change is age. And that is probably the biggest risk factor for dementia. So as we age, you're going to be more and more likely to have dementia type illness. Doesn't necessarily mean that you're going to get it, because there are people that are way up in age who, are on point cognitively, have good brain function. And it's interesting in my clinic, some of the people that I see that really have this and are on point there and have good awareness and memory, and you can hold a really very interesting conversations with them. In the elderly are people that read a lot and like constantly stimulate their brain. So it's always interesting when I run across some of my elderly clients who, they're very interested to talk to because there's a lot of history there and a lot of wisdom. And when you have that and they don't have any of these types of cognitive deficits, it's very interesting. Some of the history that you can get off of them. It's very interesting talking to them with what they've lived through.
Mm-hmm.
But age is the biggest risk factor, especially after the age of 65. Again, a risk factor that you can't change is like, your genetics and family history. So we do know that dementia, especially Alzheimer's, if you've had family members that had it, if you have a certain gene variant, I think it's ApoE4, we'll talk about that in a little bit, that's going to increase your risk. Doesn't necessarily mean you'll get it, but that's just a factor that you can't really change if you have that variant. Of course, Down syndrome, and then a condition called mild cognitive impairment. And basically, this is both these people that have this can function pretty easily. Some of them can function independently and don't constantly need to have somebody watching them like a family member. But mild cognitive impairment puts you at much higher risk of dementia. So there are two different diagnoses, right? Because a lot of times people will kind of group those together. And so what are the risk factors that you can change? Well, if you're a chronic drinker or alcoholic, stopping that right away can help.
Yeah.
We talked about cardiovascular risk factors. One of the biggest ones, we did a podcast on this, right? Is really quelling your making sure that your blood pressure stays optimal. Anytime you have high blood pressure over time, it puts a tremendous amount of stress on the arterioles, capillaries, and that type of thing. And over time, it decreases blood flow, oxygen, nutrition to the brain cells. And so cardiovascular risk factors are a big, big deal. And what's related to that, closely related to that, is diabetes. This is interesting because I see this a lot in older people, is depression. Okay. And chronic depression increases risk of dementia. But one of the biggest risk factors for morbidity and mortality, especially in older people, is loneliness. And loneliness in itself can contribute to dementia. Mm-hmm. So again, it kind of speaks to that social interaction and connection with other people. So, making sure that you are staying active and socially involved with your peers or groups or things like that. This is where church activities or just doing activities. A lot of times in retirement communities, one of the things that they're very good at is making sure they're constantly having activities going on for people. It's like exercise classes, music classes, people that are coming and giving talks and stuff. I've given a couple of talks at retirement communities and stuff. This stuff you can think about it as a form of treatment.
Right. Yeah, absolutely.
Another one that we know is smoking. So if you're smoking, you're definitely causing the blood vessels to be compromised. And then another big one is, and a lot of people suffer from this, is sleep apnea. So people who snore, who have episodes where they stop breathing while they're asleep, can have memory loss. Over time, this can, this certainly is not going to help with dementia. But all those things we just mentioned are things that can be treated and prevented.
Yeah, modifiable risk factors. So something you can do about it.
Right. So there's definitely something you can do about it. One of the things, the way I like to explain this a lot is with aging. One of the mechanisms of aging is just a buildup of cellular trash in the cells, right? Where the cells no longer work efficiently, where they can't kind of clean house, so to speak, as efficiently. And so anything that will keep that buildup of trash at the cellular level from accumulating is going to help with dementia type illnesses. The analogy that I like to use is, if you live in a city where the sanitation workers or trashmen no longer come, the trash will build up on the streets. And then what happens? It will block the streets. Now people can't go to work. Like the city, if you think about it as a cell, analogous to a cell, cannot work efficiently anymore. This is what's actually happening in the neuron. So anything that you can do to help prevent the buildup of cellular trash is probably going to help in at least preventing dementia and dementia type illnesses. So what are those things? I mean, those modifiable risk factors, certain things like exercise, reading, stimulating the brain, that all can help. There's lots of complications that can result from dementia, because dementia really can affect all the body systems, so to speak. So if you have dementia type illnesses, a lot of people will stop eating. They don't drink anymore. We already talked about not drinking water. So they're not well hydrated. They may even have difficulty chewing or swallowing. There's choking risks with it. There's inability for self-care, right? So it can interfere with bathing, dressing, brushing teeth, all those types of things. Those things can lead to other types of illnesses and complications. There's, of course, personal safety challenges. I mean, how many stories have we heard about people just, if they're not being watched, walk off and leave, and people can't find them. They wander, they get lost, they don't know where they are. And again, another complication, death from dementia, usually, it's not really dementia itself. It's usually, some form of infection or something like that, or some type of trauma that has caused that. So let's talk about, we've hit on this a little bit. Let's talk a little bit about prevention then with dementia. We talked about keeping your mind active. So what are some of those things that you can do to keep your mind active? Well, we talked about maintaining social interactions, right? Anytime you're talking or communicating to somebody, you're using your brain. That alone will help. But, things like crossword puzzles, luminosity, that's internet brain games. There's some indication that stuff may help, just challenging your brain, reading everything, using reasoning and logic. It's really important for staving this thing off. And I would even say, really trying to don't get cemented in your points of view, like really trying to understand other points of view. Again, doing that actually stimulates your brain more than being like, my way is the right way, that type of thing. So in conversations with people, being physically active, and of course socially active. Quit smoking. We hit on this, vitamin D. Research suggests that people with low levels of vitamin D are more likely to develop dementia type illnesses like Alzheimer's. The best way to get vitamin D is through sunlight, getting outdoors, getting sun exposure. And in the elderly, the best way is to certainly supplement. So it's a good idea to get vitamin D. I can't tell you how many times that I have tested vitamin D levels across all ages, and most people are low normal or actually diagnosably deficient in vitamin D. And that's because we spend our lives indoors, right?
Right.
Vitamin D also helps with the immune system. So making sure, if you boost up your immune system, that kind of speaks to the whole, infectious side of causes of dementia. So if you have an adequate immune system, you're going to be less likely to have bugs causing problems in your brain, which research is now thinking that that's at least one risk factor or cause of dementia, and one way to possibly treat it, right? With like antimicrobials or antivirals or vaccinations, that type of thing.
Yep.
I can't state this enough. Lower your blood pressure. We talked about that. And then, of course, maintain a healthy diet. And when people ask me, Brian, like, what is the best diet out there? And I'd be wrong to say it's not the Mediterranean diet. I mean, there's so much research on it. The Mediterranean diet, and I'm talking, the Mediterranean diet is very high in phytonutrients. We're not talking about the stereotypical Italian-American diet, which is pasta and bread. We're talking about a diet full of vegetables, nuts, seeds, olive oil, maybe some red wine with those, polyphenols in there, green tea, like any way you can get some of these plant compounds into your bloodstream. It's huge. So a Mediterranean diet actually promotes lots of vegetable and fruit intake. That's probably the best diet. That's one that we have the most research on. So that kind of gives us an overview of dementia, risk factors, modifiable risk factors, that type of thing, the types of dementia, medications, other things that look like dementia. But let's talk about the most common type, and that is Alzheimer's disease. And there's a lot of overlap with Alzheimer's disease and other types of dementia. But it's basically a consequence of several convergent factors. That includes oxidative stress. So think about free radical damage to the brain. You can think about it that way. You can think about inflammation. Think about, again, inflammation putting stress on the brain. We know that heart disease, diabetes can increase inflammation in the body and the brain. Mitochondrial dysfunction. Mitochondria are the powerhouses of your cells. They create ATP to give you energy. If you're not creating mitochondria adequately, you can't clean out that cellular trash in your brain. Mm-hmm. So mitochondrial dysfunction is a huge deal. And again, accumulation of trash in the brain, like protein aggregates. So one of those kind of protein aggregates that we see a lot, they're called senile plaques. You probably heard of amyloid beta accumulating in the brains of Alzheimer's patients. It's like a telltale sign that you have Alzheimer's disease. All it is cellular trash in the brain, and if you see high amounts in the memory centers of the brain, like the hippocampus, you're going to have memory deficits and cognitive dysfunction there.
Are you going to pick that up with imaging?
Yeah, usually this is that it's actually a good point you bring up, because Alzheimer's, or I should say dementia type illnesses, especially Alzheimer's, it's really a disease. It's diagnosed by exclusion, right? So you rule everything else out in the living person, and rule out all the diseases, all the other things that may contribute to that. And then you can come up with and of course you have like some imaging studies and memory tests and stuff like that, and you can come up with Alzheimer's disease. But definitive diagnosis is actually looking at the brain tissue, so after death, right? But yeah, so it's usually in the living a disease. It's a disease of exclusion to diagnose it. So you try to eliminate all the other things out there.
These plaques aren't necessarily going to be seen on imaging, then they're seen post-mortem.
That's interesting. Good question. I'm not sure. I'm thinking they would be, because there are some imaging studies that they talk about doing MRIs and that type of thing, where you probably can see like especially if there's a significant buildup. You certainly can see like on these imaging studies shrinkage in areas of the brain that may indicate things. But as far as like, can you actually identify and see these plaques? I don't know if you can actually see them on the imaging, or actually if you look at them kind of like under a microscope or stuff.
Gotcha. Okay.
It would make sense you would be able to see some of it, especially if it's really built up.
Yes.
So the other thing that contributes to that, I would say, is just another form of cellular trash, and cellular trash being a mechanism of aging, is something called neurofibril tangles, right? And these things are kind of related to the amyloid beta plaques, and they're basically what's known as tau protein clumps. Okay, and so I don't know much about this. I just know from just studying some of these neurological diseases and stuff that basically the neurons all cells contain like the cellular skeleton made up of microtubules. It just secures everything in the cell in place. And when that gets compromised, you can get an aggregate of protein clumping called tau proteins. And they clump together and just cause dysfunction and don't allow efficient communication within the cells or between cells. like the neurons and stuff. Those are words you'll see or read or hear about when you're looking into Alzheimer's. You hear about amyloid beta protein clumping, and then also these tau protein clumps. So one thing that certainly we do know that there is acetylcholine deficit. Acetylcholine is basically a neurotransmitter in the brain that helps you think, basically, right? So if you have enough acetylcholine, you can't think quickly and you get confused and stuff like that. So and this is actually a target of treatment conventionally for Alzheimer's disease, where they're actually given drugs that help acetylcholine stay around longer around in the cells. So that's something that is a conventional treatment for it. This does not mean that, having an acetylcholine deficit is a major cause of it. It may just be due to cellular communication of like this protein clumping causing the acetylcholine deficit. But again, it goes to, if your neurons can't communicate, right, then you're going to have cognitive deficit. And acetylcholine is one of those neurochemicals that help the neurons to communicate with each other.
Yeah.
It also speaks to the fact, and we'll talk about this later, that acetylcholine, there are some natural supplements that may help acetylcholine stay around longer in those neuronal synapses, so that you get this communication going on where you can be on point and communicate later and see that your memory's on point and that you're not forgetting things all the time. So, and anytime your brain is under stress, you're going to get at least an acute acetylcholine deficit. So think about when you're highly stressed, right? You're highly stressed and you can't, you're going into for an exam. If you're not prepared and you're highly stressed, you're not going to be thinking. You're not going to be using your reasonable logic. You're not going to be thinking appropriately, and probably won't do on that exam. Probably won't do well. So oxidative stress is another one, right? We talked about free radicals. Free radicals definitely will cause oxidative stress. There's so many things that can quell free radical stuff. We talked about the Mediterranean diet and exercise. Both of those things are the biggies for helping maintain what I call adequate oxidative stress, and where your body's just not overwhelmed with it. Again, inflammation, there's plenty of books out there that says all chronic disease is due to inflammation. Inflammation causes oxidative stress. So you can boil it down to inflammation. However, inflammation, one big marker of inflammation is a cytokine called tumor necrosis factor, or TNF alpha. And we see very high levels of this pro-inflammatory cytokine in patients of Alzheimer's and people that has Alzheimer's. And what does that mean? If you know that you see very high levels of that, well, the pharmaceutical companies are going to be like, well, we ought to try to create a drug that will lower tumor necrosis factor. And so some novel therapies for Alzheimer's disease are going through here that may be coming available soon. But just like with conventional treatment, again, you're talking about basically possibly symptom management, right? Here, because you're just targeting one aspect of the disease that may or may not be the main cause.
Right. Yeah.
But if you really want to tackle inflammation and oxidative stress, right, we go back to our lifestyle, go back to the lifestyle stuff, and start early in life. And that's probably what's going to really help prevent. Again, even in the elderly, what we do see is things with a change in good diet, staying hydrated, and forms of exercise improve brain function. That's across the board. We see that. Doesn't necessarily mean you may be able to reverse it, but it does mean that you can get improvement there.
Yeah.
I just want to talk about this because this is also a mechanism of aging. When your mitochondria, your powerhouses of your cells, the cells, the little organelles in your cells that create ATP and generate power for your body, when those mitochondria are not working appropriately, all kinds of things happen that are not good. It creates inflammation. It creates free radical damage, oxidative stress. There's a line of evidence that supports a link between Alzheimer's disease and the finding that this gene variant, ApoE4, that gene variant seems to, what it does is cause mitochondrial dysfunction. That's part of the reason why when people have this gene variant, they will increase their risk. They're more at increased risk for Alzheimer's disease. One thing that helps keep mitochondria working appropriately, again, I'm going back, just going to repeat myself over and over again. It goes back to exercise and proper diet, right?
Yeah.
Keeps your mitochondria happy. And then there's this other concept here where it's called excitotoxicity. One neurotransmitter in the brain that is an excitatory neurotransmitter is glutamate. And too much glutamate in the synapses can cause neuronal degeneration. And if you get that neuronal degeneration, you're going to be more likely it's going to promote the amyloid beta, the neurofibril tangles, mitochondrial dysfunction, oxidative stress. Again, so if we know that glutamate, the excitotoxicity of that, it affects a certain receptor called NMDA receptors. Now you have a target for a drug, right? So again, we're going back into conventional treatment. So if you can actually kind of use something that blocks these NMDA receptors, this drug, and there is a drug out there called memetidine or Namenda. This is a treatment, a conventional treatment for moderate to severe Alzheimer's disease. Again, it's not, there's no cure for this, but it can, in some studies, seems to help reduce the rapid onset of, Alzheimer's signs and symptoms.
If it's exocytotoxicity, basically, would you use GABA at all to kind of quell that, or is that?
Yeah, that's an interesting point. I don't know. I do know that some functional medicine practitioners will use GABA to kind of balance that out. GABA being an inhibitory neurotransmitter.
Mm-hmm.
I'm just not aware of any research that says, well, you give GABA and then it can help, especially in the cases of Alzheimer's. But it's a good thought. It's a good thought. It's like balancing out, the neurotransmitter concentrations there in the synapse. So yeah, you may be able to do that.
It's one of those things that in theory it sounds good while we talk about it until we understand more
right.
how completely wrong we are.
And I'm sure, I'm sure we can look and see, and I'm sure there's plenty of studies that have been done on that. I'm just not aware of that being a good approach where we see get a wow factor for people just, feeling much, much better and getting their cognition back.
Yeah.
One thing that happens as we age is we lose our hormonal levels for the most part, especially sex hormone levels decrease. So again, it's interesting. It's going back to all this aging stuff, right? So as we age, we know that these dementia type illnesses, Alzheimer's, are more likely to come on. And one thing that happens as we age is we lose testosterone, levels of estrogen, progesterone decrease. So in men and women, the levels all lower. And we see that these things have, if they're optimized, they have an optimal impact on the brain and help a brain function.
Right. In general, is there a sex that Alzheimer's or dementia affects more that we know?
Not that I know of. It seems that, at least in my clinic, I see, each
darn near 50-50.
Yeah. About affected. There may be a prevalence. I'm not aware of it though.
Okay. Mm-hmm.
Across the board, both genders are seen to be at high risk for this, especially as we age.
Right.
But declining estrogen and testosterone levels are associated with those amyloid beta and tau protein abnormalities that you'll see in the brain. And we kind of hit on this, talk about infections. There's an interesting article that came out a while ago that people with herpes viral infections, and this is really interesting because a lot of people will get those. A lot of people have the what we call the oral herpes, where you'll get the cold sore outbreaks around your lips and things like that.
Mm-hmm.
they're saying that there may be some indication with herpes infections or other viral infections for increasing your risk of Alzheimer's. So that goes to the place where, well, some research is looking into vaccinations against these things. So that's interesting, right? So maybe like a vaccination, like the chicken pox vaccination or something like that. It'd be really interesting. And we probably won't know for decades, but it'd be interesting to see if the incidence of Alzheimer's goes down because of, vaccination schedules and stuff. And it's not just against viruses, right? There's also certain bacteria that can actually linger in the brain and drive inflammation. Mm-hmm. And whenever you drive inflammation, you're going to get some of these amyloid beta and tau protein aggregates, the hallmarks of the disease. So that leads to things like, all right, so vaccinations, maybe some antibiotics, things that may lead to treatment. We've been talking about inflammation over and over again, right? Anything that can quell inflammation can lead to a drug that is anti-inflammatory that may help. So these are all some of the things that research is looking at. What else? Just to review, and we'll wrap up here is, when you think about the risk factors of it, there's a lot you can do when you really think about the risk factors. You can't really change aging, right? All of us are going to age, but all of us age differently. So there's something called chronological aging, which definitely is a risk factor, but there's also something called biological aging. And the people that tend to live a healthier lifestyle, that exercise and that, tend to eat right, tend to keep their social interactions, connections, just don't drink to excess, are not smoking. I mean, those people are biologically younger. You can look at blood labs on people, and you can look at their hemoglobin A1C, their inflammatory markers, and you can see all those things are less, which means that they're aging at a much, much lower rate than people that don't, put in those healthy lifestyle changes. Right. So you can change your biological age. You certainly can't change your chronological age. We talked about the family history of Alzheimer's. This does not mean that you're going to get Alzheimer's, all right? But it does mean that you are going to be more prone. So these types of people really need to think about, if you see it in your family, things you can do to help prevent.
Yeah. All those things we just listed.
Right, all those things we just listed, and a lot of people that have it in their family have this ApoE4 genetic variant, right?
Is that something you can easily, could you get tested for that easily, or?
You can actually some of those things out there, like 23andMe, can give you an idea if you have these variants. Yes, you can do a genetic test to see if you have this ApoE4 genetic variant. And some of these SNP genetic testings will give you an idea of that. Mm-hmm. So like 23andMe, there's plenty of others out there. I'd say the biggest modifiable risk factor there is really, if you have high cholesterol levels or high blood pressure, you need to get it under, or high, I should say not high cholesterol, but I should say like high blood lipids, but the most important, high blood pressure. If you have that needs to be under control. If you have high blood sugar, you got to get that under control. Type 2 diabetes, we talked about this on the podcast. This is a disease that really can be reversed. There is a cure for type 2 diabetes, especially if you catch it early enough. Mm-hmm. And you certainly can improve it.
Yeah.
These things are modifiable things that you can improve. So if you have these diagnoses, there's so many things you can do to, reduce your risk or bring those levels down, sugar levels and blood pressure, that type of thing, blood lipids down, that will help. One test that I run on everybody is homocysteine levels. You can think about, if you have high homocysteine, it's just a marker of inflammation. Checking nutrient deficiencies. If you're maintaining good hydration, making sure that your blood pressure is low. If you have cardiovascular issues, making sure that you're preventing any type of stroke risk. I think we did a podcast on blood clotting in the past. So maybe a good one for people to like just look at. And then, you are at risk. You are at risk for dementia if your waist is much big, much bigger than their hips. All right. So waist to hip ratios. So central obesity is a big risk factor for dementia type illnesses and all those chronic diseases. We talked about, we briefly hit on how Alzheimer's disease can be diagnosed. It's diagnosed by exclusion in the living. In other words, physicians must confirm the neurological deficits are not being caused by other conditions. So the standard diagnostic strategies comprise of collection of detailed patient history data, standardized assessments of cognition, functional status, like mini mental exams, laboratory testing, brain imaging. This goes back to what we were talking about, MRIs, PET scans, SPECT scans, that type of thing. So all of those can help with the diagnosis of Alzheimer's disease. So I want to end there, Brian, because I know that's a lot of information to go through. And then I think the next podcast, let's just go over like treatments, conventional and unconventional, especially the unconventional, which is my passion, which I think, people can really start putting a lot of this stuff into practice, like as soon as they know about it.
Yeah, that'll be great, because you see it affect so many different people and then just affect so many families, because when people change like that with Alzheimer's or dementia and they're no longer who they used to be to their family members and things like that, it's huge. I mean,
yeah, it's a huge stress. You're talking, and you're huge personality changes. Like the people are like, yeah, I'm living with somebody completely different now.
Yes. Yeah.
And some of the early signs and symptoms of it, people may not realize what's going on. Like if somebody becomes really belligerent or starts accusing you of family members of things that are just, kind of outrageous and that just have no reason or logic to it. And people are just wondering what's going on. A lot of times this can be a sign of dementia.
Mm-hmm. Yeah.
So
I've seen. Go ahead.
Well, I was just saying I had like families who would come in and they were so distraught and didn't know what was going on. And it's like, well, they need to be checked for this.
Yeah. Yeah. I've had the opportunity to train an individual who did have dementia, multiple TBIs, and was in the advanced stages of dementia. And kind of like you were mentioning there, where he was somewhat estranged from his family because of the early, stages of it and what happened there, and the person he became or whatnot, and just how his family didn't necessarily understand at that time.
Right.
Just to see, for me, how cognitively declined you could get. It was huge for me because I've seen people with dementia, but not, I've never worked with anyone with dementia before this time. And just to we would work out at the gym of my apartment complex. And he wasn't necessarily aware we were at the gym of the apartment complex that him and I both lived at.
Right.
And we walked there together to the clubhouse, 10, 20 feet. We never even got in a car. So just to see that low level of cognition it's crazy. So to take it into your own hands and modify all these risk factors, or take as many things like you were saying, where keeping your brain healthy, reading, all that kind of stuff is huge. And
it is huge. And think about the stress that puts on a family, where you have to monitor somebody at
24/7.
Really, you pretty much do, to make sure they don't leave the house, to make sure they remember where the bathroom is in the house, to make, there's a lot. It's very, very, very stressful for family members.
Mm-hmm. Had to completely modify the kitchen because you'd, turn on the stove, forget about it, that sort of thing.
Right.
So just, a ton.
That's, so when I see families or people with dementia, especially in the advanced stages, I mean, it's really a lot of counseling maybe can be helpful for family members who are actually having to be the caretakers for them. And so a lot of these families actually have to get if they can afford it, get, hire somebody to watch them 24/7. But yeah, it's, it's very stressful. And, the other thing about it is many of these people, it's not that the disease actually kills them directly. It's like, so for example, we had a couple people where the disease was so advanced that they really could not function. And the caretakers, really just had to keep them in a chair most of the day where they weren't moving, and that in itself is
Declines
problematic.
further. Right.
Oh, well, it declines further, and guess what? Prolonged sitting, which we've done a podcast on, what does it lead to? It can lead to increased risk of stroke. 2 of these people actually died from stroke, from sitting
Oh,
too
wow.
long and not moving. So
Wow.
it speaks to what you were doing with your client, is making sure that they're actually moving.
Right.
Which is great. And that can be, even passive movement, not necessarily active movement, can be really, really helpful for a lot of these people, especially in the advanced stages. But yeah, it's an awful disease. It's highly prevalent the older you get. And, I would say nobody is really immune to not getting it. Some of the studies of age populations throughout the world, where they tend to be very healthy well into age. One of the big things that really, really helps these people, and I think in our society or Western society, we don't do well at, but in some of these long-lived communities, you see really, really tight social family connections with people. And in this country, unfortunately, you kind of get to see in the elderly, they're kind of like, for lack of a better term, like a throwaway population, right? They're kind of like, we put them, most of them no longer live with family. They're kind of isolated in your retirement communities. They no longer really have a lot of interaction with younger populations, this type of thing. And it's kind of like we isolate them off. And I think it's a big deal, because we do know that maintaining your social interactions is actually anti-aging in itself, especially for the brain. So anyway, that was a lot of information to go through, but next time we'll go through some of the things that people can do as far as treatment goes. Anyway, I hope that was helpful, everybody. Just let us know if you have any questions. To get all these notes down, I used a lot of resources, but you can find a lot of this information. It's all over the internet if you look at it. So we just want to put it all in one place into this podcast.
Awesome. And we'll see you next week with some treatments, conventional, unconventional, and further ways to manage it.
Yeah. All right. Take care, everybody.